wanted to talk today about our manuscript that focused on how can we perform testing for COVID-19 to try and enhance safe airline travel. I'm Aaron Tandy. I'm an infectious diseases physician and associate professor of medicine at the Mayo Clinic College of Medicine here in Rochester. And I wanted to talk about our paper, SARS-CoV-2 testing prior to international airline travel, December 2020 through May 2021. That will be published in November of 2021 in the Mayo Clinic Proceedings. So as we've observed throughout the pandemic, there's been a great disruption in airline travel, which has really disrupted all of society. And we recognize and realize that airline travel will have to be part of our life going forward, even in the time of COVID. And so our team, along with colleagues from Delta Airlines, the Georgia Department of Public Health, designed a testing approach to try and provide a safe travel for passengers traveling internationally. And as part of that, we wanted to study the results of that and see what we could learn. And so this paper is a result of that testing approach, whereby nearly 10,000 passengers traveled from the United States to Italy, and we report our findings from that study. So there was 9,853 passengers who had a negative SARS-CoV-2 PCR within 72 hours of departure. And all of those passengers then were tested when they arrived at their departure airport, either in Atlanta or New York, and then again when they arrived in Italy using rapid antigen tests. And so what we observed was that there was 5 additional passengers that were identified with COVID-19 infection at the time of travel, suggesting that by doing a PCR test within 72 hours before departure, we can dramatically decrease the risk of infection and of ongoing infection during travel through that PCR test within 72 hours. We found a case detection rate of 1 passenger per 1,970 travelers during this. And we estimated that using a previously developed model that the average community infection prevalence rate was 1.1% during the same time. So what can we take away from this study? I think the first thing that we can take away is that a test within 72 hours, a PCR test, can really lead to a very low rate of ongoing infection at the time of travel. We also found that while we can do additional rapid antigen tests in addition to that, those provided a fairly low additional benefit when the PCR test was already being done. I think that further work should continue on to try and validate these findings and explore how they can help with safe travel. So I would invite anybody that's interested in this topic to go ahead and read the article for further details. And we look forward to your interest in this topic.
We hope you found this presentation from the content of our website valuable. Our journal's mission is to promote the best interests of patients by advancing the knowledge and professionalism of the physician community. If you are interested in more information about us, our homepage is www.mayoclinicproceedings.org. There you'll find access to information for our social media content, such as additional videos on our YouTube channel or journal updates on Facebook. You can also follow us on Twitter. More information about healthcare at Mayo Clinic is available at www.mayoclinic.org. This video content is copyrighted by Mayo Foundation for Medical Education and Research.